you've been on the phone for how many hours with that one patient or family, and it's just really hard. And you maybe even see them come into the clinic that day, and it's like, I can't do it today. I think it's important that you validate that and you recognize it, but that you figure out what you're going to do with that. But these are those avoidance symptoms, and it can also mean that you have such a problem that you have difficulty with even enjoying things that you usually do to do stress relief. You don't take care of yourself as well. You isolate yourselves. And then as a result, because you are not doing as well, you also start losing that sense of competence, and it undermines your feelings of competence and your expertise. And then there's the whole thing of becoming silent and just flying under the radar, getting through my day. You maybe will very subtly avoid certain traumatic or painful symptoms or situations. You maybe, when you do talk with the patient, you'll be talking at this level up here. How are you doing? How are the kids? Blah, 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 blah. You chatter, but you're not dealing with some of the direct things that you know are underlying a patient's condition. And as a result, you end up with some diminished effectiveness because you are not being as effective. Now, arousal symptoms, these are really related to how you end up putting your emotions and everything almost into hyperdrive. Because you end up being you may be more anxious, you may be more worried about things, you may be more impulsive. So remember one of those questions I asked about, that was asking about taking risky behaviors? So kind of that impulsivity and reactivity, you're trying to put value into your life, and so you maybe do things like go bungee jumping, go skydiving, some of those more risky behaviors, maybe even driving after you've been to attitude adjustment when you shouldn't be. But these are symptoms that you're not taking care of yourself. You may be increasingly frustrated or angry. Like you get that phone call, and you're usually pretty calm when you're talking to the insurance company, but this is that third phone call, and you're just like ready to rip their head off. And then you're also looking at what are the somatic symptoms. You GI upset, you're not sleeping at night, you may gain weight, you may lose weight. These are all some of those symptoms that can come along with this compassion fatigue. So as I mentioned, you might use those and have people go through and kind of mark off, well, is this something that I have a concern with? Is this a change for me over the last few months? So then the next thing in here is the professional quality of life scale. And it's on the second sheet of paper. It's actually 3 pages. And this is a really nice, these measure the subscales of compassion, satisfaction, burnout, and compassion fatigue. This is a well-used tool. It's been around for probably 20 years. And the idea is a 30-question, 5-point Likert scale. And you go through and measure it, and you think about how you've been feeling for the last 30 days. Okay? And so this is a way you can then mark off your scores and kind of identify where your needs are. Because when you're looking at this professional quality of life, you're going to be looking at, is your compassion, is your risk for burnout and compassion fatigue gone up, and your compassion satisfaction has gone down. So this is a tool that you can use. Either do it for yourself or use it, with staff members. I went through and did it myself, and I was happy to find that I wasn't in any of the categories. But it made sense when I went through the questions. So then after you've had that tool, what can you do to put that joy back into your work? Because let's face it, if we're going to be successful in work, we want to have some fun, don't we? And so some tools, and we're going to see, I have to catch up. Okay. And when you've looked at some of your tools, you may find out that there are some areas that you might have some work to do. So think about when you're putting the joy back into work, what are the traits piece of teaching tolerance and being accepting of other people and other beliefs. Teamwork and collegiality, I cannot tell you how important that is, because if you all support yourselves, you are going to do much better. I am fortunate at this point that I have a lot of really strong team members, and I can tell that because I have patients that will stop me in the hallway and tell me, Renee, your team is so awesome. I just love coming in here. Your nurses all care. You work well with the doctors. And I've had that happen several times in the last month. And it's like, okay, we are in a really good place right now. We've got some really, really strong teamwork. And also focus what's true. And so, and this, I can't help but think, of course, no fake news. But it's that whole piece of you don't have team members that are doing the gossiping, they're not into the drama, they're not rumor mongering, and those are all things that can really undermine your whole relationship and people's compassion fatigue. So when we talk about this, the question about what can we do, what can we carry with us, at the grassroots level, what we can do for yourself right now is be kind to yourself. Give yourself a break. How many times do you drive home from work and you're saying, I could have done this, I should have done this, I would have done this if I had more time? Let that go, okay? You did what you did a good job, and give yourself that break. Educate yourself, that might be journal club. I was in my nurse leadership meeting this last week, and our CNO said, you know what? Things have been so crazy between, surveys, between a variety of things, and she said, every 2 weeks when we have our nurse leadership meeting, we are going to take turns, and somebody's going to bring an article, and it will be distributed. We'll have a mini journal club, things to educate yourselves. And so this is also something you can do with your staff and your colleagues. If you look at your scale or your symptoms, accept where you are. And don't beat yourself up, but start making a plan for going forward. And this is really important, is being able to talk to your coworker and talk to your colleagues and understand and listen. And I think it's important that this is the important piece. Nurses love to fix things, right? Okay? We love to fix things. So when people start talking to us, what do? Right. So it's called sit on your hands, or put your hand over your mouth and listen and be able to validate what people have to say. Understand what they're saying. Now the risk with this is you don't want to get sucked down into that black hole with them. But to be able to validate what they're saying and then maybe look at some other resources. But really, it could be that first time you sit down with them, all you do is listen. Sometimes you have to think of it as dealing with a teenager. And then, if you're going to listen, you're going to understand, you don't want to get sucked into the black hole, so you're going to clarify what your boundaries are. Okay? That can be those boundaries of whether or not you're going to refill those prescriptions, but also the boundaries on what are we going to do with our coworker. When you have a coworker that you hear the same thing time and time again, that you're kind of going, oh, this does not sound good, what can you do to help that person? And how can you talk with them and help them make changes in their lives? At the same time, express your needs. So if that person is getting ready to drag you down into that black hole, say, you know what, I'm with you, I understand, and this is what I'm doing to make a change in my life. Do you want to join me with me and go on a walk every day at lunchtime so we get out of here? And so when you can do some of those things to take care of yourselves and taking that change to change your environment, okay? This is the other handout that I gave you, and this is something that you can work on for yourself as well. You have a blank there, so you can make copies. And you'll also notice that this is from socialworktech.com. And they also have a short video on YouTube that helps you walk through this. But it's basically asking some questions that you need to ask. So what do you do for yourself? For instance, so the first one with mind.